Hello, everyone. It's Dr. Cary Yurkiw, and welcome to our live event called Neck Pain. We're going to be going over what causes neck pain, what you can do to help yourself with neck pain, and then what we do in the clinic to help people. I'm glad you could join us this morning, and we look forward to doing more events like this. Ones on back pain and headaches, whiplash. So just watch our events tab on our page and you'll be able to see the upcoming events that we have in our clinic. So my name is Dr. Cary Yurkiw. It's my 27th year of practice, and I've seen a lot of people with neck pain over the years. I've done many locums, especially in the first few years of practice, which is when you take over for another chiropractor when they go away from their practice, either on holidays or they get injured or sick. And I had the privilege of working in over 50 clinics as a locum doctor. So I got to see a lot of different patients, a lot of different practices. And I did that in Manitoba as well as more recently in British Columbia. Currently, I have my own practice in Kelowna. We are accepting new patients. And I've seen hundreds to, I would say, thousands of neck conditions where people have been injured, people have misalignments, poor posture, all the things we're going to go over today. So, neck pain. What causes neck pain and what can be done to help? Just a disclaimer. If you have neck pain, it's best to consult with a health professional about your specific condition. So seeing somebody who can properly diagnose it, treat it, and then give you the best advice is the best option for you. If you live in Kelowna, you can certainly contact our office. I'd be happy to help you. But if you're in another area, find a chiropractor in your area, go see them, and get a proper diagnosis and treatment for your condition. For the anatomy of the neck, there's 7 vertebrae in the neck, and this is called the cervical area. There's discs that are in between the bones. There's cartilage, and the bones form joints. There's a disc in the front and 2 articulations, 2 joints in the back part of the spine at each level. This allows you to move, bend, and twist, but it protects your spinal cord. So the spine protects that main highway that goes from the brain down through the spinal cord and then out of the spine to various parts of the body. So from the lower back, the sciatic nerve goes down the legs. From the neck area, the brachial nerve goes down the arm to your fingertips. So we'll focus more on the brachial nerve today because we're talking about the neck, but most people have heard of the sciatic nerve, and it's a similar type of structure in the neck as the low back, but these nerves go down the arms right to your fingertips. The movements of the neck are flexion, bending forward, extension, bending backwards, and this can be really difficult. I find for patients that their neck gets pinched or the nerves get pinched when they bend backwards. So most people when they come in have a problem going backwards into extension with their neck, and it can pinch it. In fact, when I start treatment and the patient starts feeling better, I advise them not to extend their neck for a while so they don't pinch that and cause a reaction, a protective mechanism, kind of set us back. And I also give stretches and exercises to patients, but usually in the other directions, and I leave the extension exercises until last because I just don't want to risk any type of setback for the patient. The other movements are twisting, right and left, and side bending, what we call lateral bending to the right and left. The physiology of the neck, there's nerves that are in the neck area coming out of the spinal cord into the muscles, into the tissues, and then down the arms. So there's many branches, including some that go into the shoulder blade area and some that branch out into the chest area too. So sometimes, I'd say often it's common for someone to come in and say, hey, I've got pain in the shoulder blade and it seems like it's coming from this area. So they think sometimes that it's more of a shoulder problem, but really it's coming from the neck area. So that's something common that we see in the clinic. There's blood vessels running through the neck area. There's muscles in the neck area, many layers, small muscles in between the bones, and larger muscles that span several segments or the entire area, like the scalenes or the trapezius, some of these larger muscles, the sternocleidomastoid, we abbreviate it as SCM. There's a lot of big muscles running through that area. And there's ligaments. The ligaments connect the bones together, like the capsules in the back part of the neck. And then the discs too. There's a ligamentous outside and a fluid-filled center, kind of like a jelly donut or a golf ball. And so the disc shock absorbs and it allows you to bend and twist and move. Then there's synovial fluid in between the bones. So this synovial fluid is a liquid that allows the bones to move one past each other without rubbing. What are some causes of neck pain? Well, trauma is one of the causes of neck pain. Somebody falls, they hit their head, they twist their neck, they sleep poorly, they have text neck. So we're going to talk about all those things today. There's also car accidents where the person has whiplash, falls where they hit their head or whip their neck side to side, sleeping in a poor position, kinking the neck, or even poor posture. These are common causes of neck conditions. What is whiplash? Well, it's a whipping movement of the neck where your neck goes forward and backward. If you think about a car, you're traveling at a certain speed. Let's say you're going 50 kilometers an hour, and all of a sudden you rear end somebody and the car comes to a stop, but your head is still going 50 kilometers an hour. So it continues forward and it's resisted by the neck and the shoulders. So there's a resistance there. There's a flipping movement of the head forward, the resistance of the neck causing the neck to stretch and some of the tissues to tear, and then a snap-back effect. And this is why it's called whiplash. So the head's heavy. It acts like a pendulum on the neck area, and it can stretch and tear tissues in between the bones. This causes instability. So when the tissues are torn, no longer are they functioning properly. They're not strong, resilient. Now they're too loose. And then there's a protective mechanism. So the muscles on top can start to spasm to protect with the damage that's been done underneath. Eventually, scar tissue can set up. And we really want to get on this before the scar tissue sets up and becomes a long-term chronic problem. It's easier to work with an injury right after the injury than leaving something for a long period of time. There's sports injuries, and so there's the impact of the sports injury. This can be an unexpected, maybe a tackle or a hit on the ice in hockey or a fall in soccer. So there's a number of unexpected where the athlete just doesn't see it coming, or they trip and fall and then they crash into the boards, let's say. So this force can cause injury to the head and neck area. There's a sudden change in direction sometimes, and trauma to the head and neck can cause injury to that area. It can also cause concussions, and lately concussions are being more well diagnosed, and there's more and more people coming to the clinic with concussion-like symptoms where they're sensitive to light, they feel tired, some of the effects of the concussion. So it's important that we properly diagnose that as well. For falls, falls can be like slips on the ice. I had a new patient call yesterday that slipped on the ice and hit their head and neck, or on a wet surface. Sometimes a slip on a wet surface, down the stairs, off a bike, tripping on a curb and falling. This can cause trauma to the neck, shoulder, and even the hand area from the fall. For text neck, it results from people having their head down. And we see this posture a lot where people are looking down at a screen, looking down at their phone, and it's straining where the neck meets the shoulders, right in that pivotal point at the cervical thoracic junction. So it causes stress and strain on the bones and the discs and the tissues around the spine, causes inflammation, can cause neck pain, and it can also cause tension headaches. So we see these conditions from text neck. Posture, sitting poorly, standing improperly, slouching, sleeping in a poor position, not having the right support for the neck, the type of work you do. Sometimes if it's in a tight space, let's say you're a plumber and you're looking underneath a cabinet and you're twisting your neck, that can kink the neck or cause injury to it. The way you have your workstation set up, your screen, your computer, those are all very important postures, and even driving. And that can cause strain and stress on the neck, and it can lead to pain and discomfort. For symptoms, symptoms are neck pain. So you can have pain on the sides of the neck, muscle spasms, referral into the shoulder area, the chest and the arms, headaches. So tension headaches are the most common that we see, but some other symptoms associated with the neck are dizziness and vertigo, where people have trouble. They'll get up off the table and they feel dizzy, or they move in a certain way and they feel dizzy, or the room starts spinning on them in the case of vertigo. For the assessment, we do a history, the examination. We'll take x-rays if necessary, and that's to diagnose the condition properly. And once we have the proper diagnosis, we also have a differential diagnosis, or what it could also be. So sometimes there's a differential diagnosis, and then we'll make recommendation for treatment. So we'll recommend care for the patient. The care will include adjustments in our case as a chiropractor, so adjustments to realign and improve the function of the neck area. And we'll also give patients stretches and lifestyle recommendations as well. So the treatment involves adjustments, and that can be done by hand. It can be done with an instrument called an activator or an integrator. We may advise patients to use ice or heat. That's just to help with the inflammation. And then supports like a pillow to fill in the gap between the neck and the surface, the mattress. If you sleep on your side, you need a bigger pillow because it's a bigger space between the head and the shoulder than there is if you're lying on your back. So it's important to discuss the way you sleep and then get the proper pillow and support for that. For prevention, we like to talk to patients about stretching and exercises to strengthen the core around the spine. We talk to patients about posture, improving the way they carry themselves. And sometimes you need the adjustments first and be able to get into that posture and hold that posture. The ergonomics, the workstation, the way you work, that's very important. And then the lifestyle. If you're getting, make sure you're getting enough rest, the food you're eating, stress management, they're all very important in preventing reoccurrences of the strain in the neck area. If you have neck pain, we're currently taking new patients in Kelowna. So our phone number is 250-486-0062. I did write a book on neck pain. You can find that on Amazon. And it took a while to write that book, but it did get published in 2019. It's in 3 formats. There's paperback, there's the ebook, and there's the audiobook. It's also in the Kindle lending library. So if you have Kindle Unlimited, you can read the book through that book sharing program. For future webinars, we will be talking about back pain, whiplash, and joint pain at future webinars. Most of the webinars are free, and they're right here on our Facebook page. So all you have to do is to sign up for them. They're on a weekly basis, and we do most of the webinars on Wednesdays and Saturdays. So please join us for the webinar. We do record them, so they're available after the live webinar, but you can also send a link. So if you click on the webinar, you'll be able to copy a link and send it to a friend or somebody that may have neck pain, and they can watch it and understand more about what's causing their neck pain, what they could do to help themselves. Our clinic's located on Dixon Avenue at the Landmark 4 building, and my email address, drcaryyurkiw@gmail.com. On Instagram, Facebook, and Twitter, our handle is at Dr. Cary Yurkiw, so you can find us in all 3 places using that handle, as well as YouTube. If you go to YouTube and type in Dr. Cary Yurkiw, you're going to find our recorded webinars there. We do have a podcast called Super Healthy. So if you're driving in the car or traveling, it's great to subscribe to that podcast. You can get it on Apple, Spotify, on Google. And usually we have recordings of these webinars or different topics that we've discussed that we've recorded, and it'll be available in that audio format. You can go to our website, caryyurkiw.com. We're currently accepting new patients, and if you're on this webinar watching this before December the 26th, use the code webinar. So when you call in or book an appointment, make sure you put in that code webinar to get 10% off your initial visit. And this offer is good until December the 26th. We are open 6 days a week. The only day that we're closed is Wednesday, so we are open on the weekends and on holidays. And we'll be in for most of the days through the holiday period. So if you need help during the Christmas period or New Year's, feel free to contact us and we'd be happy to help you. I want to thank you for joining us today. If you have any questions, please leave them in the chat. Look for our booking link in our posts. We'll go in and put the booking link in a post right after this webinar. And if you're not sure about chiropractic, you have questions, click on the link that says not sure, and then the 15-minute free consultation. So we're going to offer you that as well, just to discuss your specific problem and what we could do to help you. So feel free to take advantage of those links and the discount code I gave you today. And thanks again for joining.